Dear colleagues, you are welcome from Sechenov University, Department of Propedeutic of Dental Disease, from Russia. And my name is Anton Timoshin. I am Associate Professor of Department, and today we have very interesting topic. It is prevention of candidiasis in patients using removable dentures. Now about background. Despite innovation in prosthetic dentistry, the manufacture of removable denture belong to the most popular prosthetic category. Removable dentures are combined stimuli effect of mucous membrane and neuro-receptor apparatus. Acrylic plastic prostheses widely used in prosthetic dentistry have a negative side mechanical, chemical, toxic, sensitizing and thermal insulation effect on the oral tissue and prosthetic impression area. And on this slide you can see our patient. Yes, on the left side you can see patient with removable dentures. In the center you can see patient without removable dentures. Yes, with elation of the hard palate mucosa during adaptation to removable prosthesis. And on the right side you can see removable upper jaw plate prosthesis. And now about our methodology. It was observed 100 patients with oral candidiasis of various age group from 45 to 65 years. Of these, 60 patients with removable plate prosthesis, 40 patients with partly removable prosthesis, and chronic form of candidiasis were diagnosed in 40 patients, and with exacerbation of chronic form of candidiasis it is 60 patients. All patients with oral candidiasis endowment the following laboratory tests: microscopy of direct smell from the mucous membrane of the oral cavity in order to confirm the diagnosis of oral candidiasis, and the diagnosis of chronic atrophic candidiasis was made in 26 patients. Yes, chronic atrophic candidiasis was diagnosed in 43 patients, and the diagnosis of chronic hyperplastic candidiasis of oral cavity was made to 13 patients, and 17 patients who applied with diagnosis with acceptable of the chronic hyperplastic candidiasis. On this slide, yes, you can see our diagnosis. On the left side you can see acute pseudomembranosus candidiasis. Yes, on the middle screen you can see candida angular hyelitis. Yes, for old patient, and right side acute atrophic candidiasis. As a result, yes, of conducting enzyme immunoassay of the blood of patient with chronic form of candidiasis. Approximately patient have increases content of immunoglobulin G in the blood serum and others. It is, you can see on this slide. On this slide you can see our patient chronic hyperplastic candidiasis is on the left side, and you can see what difference between hyperplastic candidiasis and atrophic candidiasis is on the right side. And about our resultant discussion and about our conclusion, our research. Yes. First, removable plate prostheses have a negative effect on the oral cavity mucoses. The presence of candidiasis in the oral cavity hard the maximum intensity in candidiasis, and the quality of prosthetic treatment of patient with partial and complete and quality of removable dentures depend on many factors. And thank you so much for the opportunity to speak at such a great virtual conference, South Brazilian Journal of Chemistry. And